Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and joining me today is nursing thought leader Sara Fung. Thank you so much for being with me today.
Thanks for having me. I'm so excited to be part of your podcast.
Well, it is an honor because you were podcasting before in the nursing world long before I was. I'll just give a brief overview in case someone happens to be listening who doesn't know who you are. But Sara has been a registered nurse since 2007. Her expertise is in maternal child health with clinical experience in obstetrics and the NICU. She's worked in academic and community hospitals and home health as a bedside nurse, then an educator, an advanced practice nurse, and a professional practice specialist. She's making a difference through healthcare advocacy as a keynote speaker with the National Speakers Bureau. And she's also the former co-host and founder of the Gritty Nurse podcast, which is what I was referring to. And she's the #1 bestselling author of The Wisdom of Nurses. And so thank you for joining me from the faraway land of Canada.
Yeah, thanks for having me. I think it's great that there are so many nurses and so such a great community here, and we can all share and learn from each other.
Yeah, definitely. And we have plenty in common. Like people like to talk about the difference between the US and Canadian health systems, but I think the nursing experience is pretty similar from my Canadian nurse friends that I've talked to. So you have been counseling people or coaching nurses as they look for new jobs, whether they're at the bedside or if they're wanting to go remote. Is that right? Or is it just when they want to transition to remote?
I help nurses at any stage, right? So if nurses are looking to get into a certain bedside specialty, if they're looking for their first non-bedside job, remote seems to be a really big thing right now. So I do help a lot of nurses find remote jobs. It's not the only thing I do, but certainly it seems to be what people are asking for right now. And because I've done so much with my career and, I kind of learned through trial and error. I didn't really have anyone helping me. I wanted to be that person that could help nurses so they didn't have to struggle the way I did. And so that's really my goal for doing what I do, whether it be career coaching or resume writing or helping nurses understand LinkedIn. It's really just, I say to nurses all the time, it's not that you don't have the skill, but we never learned in nursing school or even on the job how to market ourselves. And networking seems to be a really big thing that nurses are afraid of. So I just want to help break down those barriers and educate people on how they can, get to their next job or their dream job.
Yeah, and I've listened to you on other podcasts before talking about what even is networking. And could you explain what networking is and what it isn't, to kind of demystify the process for other nurses?
Okay, so I just want to paint a picture. What I think people imagine with networking is that you go to this place and you're all dressed up and it's very stuffy and formal and you gotta awkwardly, grab a beverage or a snack and talk to people you've never talked to and then wonder what you're doing in this place. So that is just one part of networking, right? Like there's how you and I ran into each other through similar circles or
Mhm.
online. There's many different ways to network. And what it really means is making sure that people know who you are and people trust you to take that next step, whatever it is. So I just sort of imagine networking is like you're asking a friend or someone, I need to hire someone. Do you have any recommendations? And the person that they mention is probably someone they know personally, right? So it's making personal connections and making sure that people know who you are and they trust that you can do the job or whatever it is. So I think it's really just about building relationships and nurses are already great at that, right? We're good at
Exactly.
working with patients, we're good at working with family members. Some people are more challenging than others. Some coworkers and bosses are more challenging than others. And that's just really what networking is. But it's, having a goal in mind, right? Maybe you want to find a new opportunity or you want to shadow someone or you want to try something you've never tried before. That's really what I think networking is. And it doesn't have to be something big or scary. People who are introverted like myself can still network. It just may look a different way.
Yeah. And, I've been on LinkedIn more active, like the last 3 years or so. You were probably one of the first people I actively followed because I really love
Oh, wow.
your encouraging content. As a nursing thought leader, you're really great at making things seem less overwhelming, and you have a very positive, I don't know, I don't wanna disrespect it by saying vibe because it's not like woo-woo at all. It's just, very positive, and so I do intentionally try to follow really positive people, and so thank you for putting that out there consistently. But I think something that a lot of people feel about LinkedIn is that it's just for people if they're looking for a new job. I've had the same job the whole time I've been super active on LinkedIn, and
Mhm.
and I've been networking my heart out. And you know what? It has really helped within the bounds of my current job because one of the things that I do is connect patients to community resources, national resources that I never would have found out about if I was not meeting new people who were outside of nursing or outside of our immediate, you know, the list of that I was given when I came into this job, right? And
Mhm.
things are always changing. There's so many times we'll have different companies we work with for different products for our patients, and the reps will change. And
Mhm.
thankfully, I'll reach out and be able to find out who the new rep is. But it's really great when you can get personal introductions instead of just calling a company and asking them, who do I talk to? Right. And
Mhm.
so and I go to a lot of events in our community as well to learn what other nonprofits are doing, and how those services can do benefit the community. And like I can go into it not trying to sell them anything or have them sell me anything. It's just, what do you do? And meeting people with curiosity has opened so many doors. Like I found out there's a bunch of, or not a bunch, there are several free health clinics in our area. And that's how I found out about Mark Cuban Cost Plus drugs because that's how they were getting affordable medications to the uninsured patients who otherwise would have no access.
Mhm.
So just, it's amazing how much you can learn from meeting new people with no agenda, really.
Right, right. That's exactly what it is. I think that there's this idea that you should only network with people who have something in common with you, right? But
Yeah.
the best conversations I've had have been with people who I have absolutely nothing in common with, other than the fact that we're at the same event. A couple years ago, I actually joined the business bureau in my area and met people, who worked in mortgages and finance and all these industries that I'd never had exposure to. And
Mhm.
just learning how they think and learning how they do business was really interesting. And I think, even just going back to LinkedIn, a lot
Mhm.
of times I tell my clients, if you're trying to find your references because you're preparing for a job search and your former boss has moved, right? LinkedIn is a perfect place to find them again because
Mhm.
people change emails, they change phone numbers.
Mhm.
You just don't know where they are anymore. And LinkedIn is the place to be. And you're right, you don't have to wait until you're looking for a job to get on LinkedIn. It's more about networking with other nurses or people that you're interested in, following people that inspire you. Yes, there's a job aspect to it, but it's great to be active kind of all the time. Not that you have to be actively applying, but just kind of
Mhm.
building your presence. And I hear all the time from nurses that they don't have a voice and no one's listening. This is a perfect place to kind of build your platform and have a professional voice. And I think that I've met so many people I otherwise wouldn't have met if it wasn't for LinkedIn and other social media platforms.
Exactly, and I don't know about you, but I've seen quite a few how do I say it's nursing leaders talk about, not getting a lot of response from nurses on LinkedIn, but I don't think a whole lot of nurses are hanging out on LinkedIn. They're on Instagram and TikTok mostly, wouldn't you say? Or in Facebook groups and things like that. Because if you don't have the title of nurse leader, do you think those people are even comfortable being on LinkedIn because they are afraid maybe their boss might see them on there and feel like they're betraying their position or something?
Yeah, I totally feel that. There's a lot of myths about LinkedIn. I'm still hearing from nurses right now that they don't need to be on LinkedIn because LinkedIn is not for nurses and it's not for healthcare professionals. And that is absolutely not true because I talk to recruiters who spend about 80% of their time on LinkedIn looking for nurses to fill positions, right? And if you're not where they're already at, then I feel like you're missing out on an opportunity. And being on LinkedIn doesn't mean you have to post content necessarily. It
Mhm.
just means that you're active, right? You understand how to use it. it's yeah, like, I think it's great to post content. I mean, you post content, I post content, but it's not the first place you have to start at. I think it's just understanding where the world is evolving, and LinkedIn, whether or not you think it's important, it is a part of the job search. It's I found one of my past jobs from LinkedIn, and I've had
Oh, neat.
many. Yeah, like, I just found the job posted on LinkedIn, and what I did, this is back in the day before I knew what I was doing. I went to the company page, I started adding all these people, and whoever added me back, I would just ask them, "Can you tell me what it's like to work at this company? Because I applied and I have an interview coming up." And I had people flat out tell me, "No, I can't help you because you'll have an unfair advantage." I had people not respond to me, but I had one person who did respond, and we actually spent an hour on the phone, and she had the role previously, and she kind of told me everything I wanted to
Perfect.
know, right? So sometimes you have to put yourself out there and know that not every time you're going to get a response, and you're not always going to get a positive response. But if you keep putting yourself out there,
Mhm.
eventually I think good things will come your way. And same with being on a job search, right? You only need one yes. You only need one yes, and that's really what you're aiming for.
Yeah. Have you seen some of those posts where I think there's this girl on a mission to get rejected 1,000 times?
Oh, you know what? I saw a TEDx video, but it was a guy that did it, and he got
Okay.
rejected so much, and it was funny at first, right? And then he started thinking like, I wanted to get rejected because I needed to get over my biggest fear, and rejection is part of learning and moving forward.
Yeah, and it can be really hard to not take rejection personally, but especially in a job search, like how often is that personal, right?
Mhm.
And
Yeah, like I
especially
think
when you're pitching yourself to different people and like you gotta share what your message is enough times that it comes out smoothly, and it's just not gonna come out smoothly the first 10 times, right?
yeah, yeah, and I think that a lot of times now people are getting rejected with no feedback, right? And it's hard
Hard.
because you don't know what you're doing wrong, and you think maybe I need to keep applying. But then this is where I think the networking comes into place again, because if you have a connection, even if it's someone you don't know very well, but they're able to pass your name along, I think that will really help a lot. It's like what I envision is like you're lining up for a concert, right? And there's 100 people in front of you, but you just found the back door in. And you don't need to line up, and you don't need to wait for 2 hours. So that's really why I think networking is important.
Yeah,
And it's something that you just have to get into the habit of, right? It doesn't have to be when you're looking for a job, then all of a sudden you're going to start networking. Like
that
it's
makes
more
it
like,
really awkward.
right. It makes it awkward. Like just, it's like a friendship, right? Like you kind of want to keep things going, and not just when you need something from someone, then you ask them, how are you doing? It's like, let's just keep
Mhm.
the friendship, keep the relationship going, and then help each other out, right? Like maybe there's something you can offer this person, even if you don't feel like you have something to offer. We all have something to offer. They might not be good at something that you are, and it's just more of a give and take kind of relationship.
Yeah, exactly. When you're coaching nurses towards remote roles, are you having any conversations now about which of those roles feel more stable versus more exposed to AI automation? Like, is utilization review a different conversation than like care management or telephone triage?
I think that we're all kind of prone to AI automation in some way, like even bedside nursing, right? I think there's conversations about AI being integrated into charting and, that sort of thing. So right now, I haven't heard of AI fully taking over any roles. I think that there is a place for AI, and we just, as nurses and in healthcare, we need to kind of embrace it and know that it's coming rather than trying to resist it. Uh, I think it's important to be at these tables, right, and part of these conversations. And a lot of the people I follow who are not in healthcare they're posting about AI all the time. And this is why I like following people I don't have a lot in common with, to hear what they have to say about it. But I think at the end of the day, nursing is one of the professions that's more AI proof, I guess, because really it's about that one to one personalized care that you bring to the table, right? So that's kind of what I'm seeing in the remote world. I think most nurses are really just trying to get their foot in the door, and they're not always thinking about what does it mean to work remote, or even that there are different types
Mhm.
of remote jobs. So I like to educate nurses a little bit about that before they jump into it.
Yeah. So if a nurse comes to you and they're like burned out and say, I just need to get off the floor, what do you wish that they understood about remote work that they typically don't before they have that conversation with you?
Well, the one thing that I hear the most is people think that they can work from home and look after their kids at the same time.
Oh,
And when I got my first remote job, my kids were 2 and 5. And I will tell you, you can't do both well. It's like you're working remote, you're still working at a computer. For the most part, you're still going to have set hours and you are going to have meetings. Some meetings, you might even have to have your camera on. So it's not like, I don't know, I guess, what people imagine, but it is going to involve some sort of commitment, right? Like
mhm.
there's not going to be, unless you create your own business and have completely total control over your hours, you are not going to be able to do that well. So that's the first thing I would say.
Yes.
Second thing is people sometimes expect it to be as easy to get a remote job as it is to get a bedside job. And with so many bedside nurses wanting remote, it does become that much more competitive.
Oh,
So it is very common, right, to apply and not hear anything or to interview and not get the job. And sometimes as bedside nurses, we're not used to that. We almost go to these interviews and they're, you're going to get the job and it's more of a formality versus actually having to put in more effort than you're used to.
so do you talk to many people who are just looking for a different bedside role?
I do. So I talk to nurses who are looking to get away from shift work. And so they are looking for, they're still interested in direct patient care, but maybe they want something Monday to Friday. They don't want to do the 12-hour shifts anymore. So there are a lot of jobs that you can do that, right? Whether it be working in public health, working as an educator. I even talk to nurses a lot about working in private sector, like working in pharmaceuticals or medical devices, where you're still working in person, but you're not providing direct patient care, but it does give you a lot of opportunity for advancement and it does pay well at the same time. So these are all things that, there are jobs that nurses know about, and there are ones that are a little bit less known, but nurses can definitely do.
For sure. And are you seeing a change in what the job descriptions are? Like if they are incorporating AI as far as the demand for more high touch from nurses or a demand for more experience with technology?
I actually haven't seen that yet. It probably is coming though. What I have seen lately though is when you go to apply for a job, you actually have to, in some cases, check off an attestation that you have not used AI to assist in your job search. So I've seen that recently, which I've never seen before.
Does that mean you're not allowed to Google? Because
No, I
if
don't know
you
if
put
that
in a Google search, it's going to use AI to bring something
I
up.
don't know if they mean like using AI to write your resume or maybe using AI to help with your job search. Like, I don't know how they would check for that, but I
Right?
did see that recently and that was interesting to me. I haven't seen too much in terms of wanting nurses to have experience with AI yet, but I
Mm.
do think it's something that is coming. So it's something to be aware of that if you don't really understand the role of AI in healthcare, might be something to read a little bit more about. I think that would be a good thing to do.
And, I'm going to bring up if you want to learn more about AI and you are a nurse, then Stephen Ferreira has created a great course, AI plus Nursing Academy. So you are welcome to check that out. I had him on another episode of the Nurse Rosa's Insights podcast, and then I joined the American Board of AI in Medicine's free Wednesday office hours. It's thankfully during my lunch break time, so I was
Okay.
able to hop in there, and that's been great for networking, but also they have a vibrant group chat on WhatsApp. And so that's a really great way to learn about like what's up and coming in AI. But ABAIM has a certification program for AI in medicine, and they've added a segment for nurses as well. So if you don't know where to start, there's a couple of places to tangibly start. And are there any others that you've seen that you would recommend, Sarah?
I follow Nurse Fern. I don't know if you've heard of her.
I wanted
Um,
to ask if you knew her.
yeah, we actually met each other at NurseCon 2 years ago. So yeah,
Perfect.
yeah. So she posts a lot about AI. She's gone to several conferences this year and talk about what the role is of AI in nursing. So I would follow her. She doesn't write specifically just about that, but I think I think the content would kind of explain a little bit more about that too.
True, yeah, I
Mm.
met her at Vive this year because 'cause we're both with Medfluencers, and she has really grown her platform based on, like, remote job offerings, like, she'll post job listings, like, you help
Yeah.
people ready for it, and she posts the listings of what's new and upcoming. So, yeah, she is definitely a great person to follow too. But her real name's Emma, right?
Yep, yep. I think most person know her as Nurse Fern. That's why I said Nurse Fern,
Right,
but her real
exactly,
name
but
is
that's the
Emma. Yeah,
company.
yeah.
Yeah. For sure. So let's see. I was going to say a lot of nurses, and I had this too, have this quiet fear of leaving the bedside means that you're not a real nurse anymore. And
Mhm,
so they're afraid they're going to lose that professional legitimacy that we worked so hard for in nursing school.
mhm, mhm.
So, do you think, like in your experience, that remote work solves for that? Or do you feel like it really does deepen that feeling of disconnection from being a real nurse?
I'm glad you mentioned this because I posted about this recently and I've been posting about this throughout the last couple years is I think it's more of a mindset shift because it's more like we were socialized from the beginning from nursing school that how you be a nurse is at the bedside from the the content of the program to the clinical rotations that you have to the advice you get when you become a nurse is like bedside nursing is nursing. It is quote unquote real nursing. It is the best kind of nursing, but the thing is, there are so many other kinds of nursing that can equally use your knowledge, skill, and judgment. And just because maybe you're not starting an IV or drawing blood or packing wounds anymore doesn't make you any less of a nurse. So I think it's more of a mindset shift you have to get over and what I call dinner conversation, right? So when you meet someone and they ask what you do, you say you're a nurse and they're like, oh, what hospital do you work at? You need to figure out how to have that conversation to where you're not embarrassed to explain what it is that you do. So I think that's part of it. And, the other part is just normalizing the conversation that there are many different ways to be a nurse. And if you step away from bedside and you don't like it, it's not the end of the world. You can always go back. I know lots of nurses who have stepped in and out of different types of roles. And really,
Mm,
I think that's the beauty of nursing is that you don't have to stay in one area if you don't want to. But where I think nurses get stuck is they don't know how to pivot and they don't know how to
mhm,
market themselves for a new role they haven't done before. And the thing I hear all the time is, well, how can I do that job? I don't have any experience. But we all start from the beginning, right? Like, as
mhm.
someone who has pivoted many times, you have to figure out how to talk about your transferable skills. And really, at the end of the day, it's how do you give someone confidence that you can do the job if you don't have 100% of the qualifications? And really, it's just about confidence and the way you present yourself as well.
And this is where we get into the fact that the majority of nurses are females, and this is a woman problem as far as if a man will apply to a job if he's only got like half of the qualifications, whereas a woman will look at the qualifications and if she doesn't meet it 100%, just be like, oh, then don't qualify and therefore take ourselves out of the running, right? Do you
Yeah.
encounter that much? Like, do you only speak with women, or have you counseled or coached men in the process as well?
Oh, I've coached men as well. Yeah, I would say mostly women though, just because
Mhm.
nursing is mostly female, but it is similar for men. Although I will say I have seen a greater percentage of male nurses move into leadership roles. I don't know what that is, if it's more, their confidence or maybe just a world of leadership that, tends to favor male applicants. But it's really something that I've noticed is that a lot of times when I'm doing coaching, whether it's career coaching or interview coaching, it's really working on people's confidence. And everyone's got something that they're not confident about in their career, whether it's a career
Sure.
gap or a job you held on to for a short amount of time. But you're right, like just going back to women, right? I talk
Mhm.
to nurses all the time who are like, I wanted to apply for this job, but I didn't have this certification, but it's like the 10th item down on the list. And
Right.
I'm like, was it a requirement or was it a preferred thing? And they're like, oh, it was preferred. So you're kind of taking yourself out of the running and not even giving yourself a chance. And yeah, there are men that will apply to jobs that they're only one quarter qualified for, and that does not
Oh,
phase, right? So I think, yes, it is a harder job market out there, but also think about what you have control over and you can apply to jobs that you don't feel totally qualified for. I've even seen a lot of job postings that say, Please apply even if you are not fully qualified. We welcome applicants from all different backgrounds or something to that effect.
Mhm.
So they're telling you to apply even if you don't meet all of the qualifications. And so that's what I think nurses need to keep in mind is that sometimes hiring managers will come up with this unicorn list that they want someone to have, but there may not be anyone out there that has all of the qualifications that would even want to apply. And
Yeah,
so right? So it's just more about what can you do to emphasize what you have as much as you can rather than focusing on what you don't have.
exactly. And I saw something also about Gen Z will not apply for a job if the salary is not listed.
I think that's changing because where I live in Ontario, it's legislated now. So by law, you have to list the salary and the range
Good.
it can't be greater than something like 100,000. So you couldn't post a job where you say the range is 50 to 150. Like it has to be kind
Yeah.
of more narrow. And you
Mhm.
also have to post if it's for an existing vacancy or a future opportunity. And also, if you interview for the job, they have to tell you within something like 90 days. They have to at least give you an
Good.
update. They can't just ghost you after an interview anymore. So I think things are changing.
I certainly hope so. I hate it when
Yeah,
you have to legislate things. It's like, really? But things are make it to be laws because of a precedent, right? Because something
absolutely.
happened to make it necessary.
And one thing I have done is even gone a step beyond is if I don't see a job posting, sometimes I'll use LinkedIn to message the person that posted it and ask them for the salary, and they usually will tell me. So you shouldn't have to go through those extra steps, but I think if you really do want to know, you just have to find the right way to ask the right person.
Yeah, definitely.
Yeah. Yeah.
Now, as you talk a lot to individuals. If you had a chance to advise a nursing school on what skill sets need to be built into the curriculum in order to train the nurses who would want to work remote and in non clinical roles, what is something you think would be helpful that's not been taught?
Oh, that's a really good question, and no one's ever asked me that before. I think computer literacy is really important, and maybe not for Gen Z, but there are a lot of nurses who go into nursing as a second, third, or even fourth career,
Yeah.
right? So I think digital literacy is really important because sometimes it seems really basic and it's like, "Oh, I you should know that," right? But I don't think that's the case. I think nurses and nursing school is very focused on clinically based tasks where we need to kind of realize with AI and everything that's coming, we need to be tech savvy as well. And so whether that means knowing how to put a document together, knowing how to video conference. I think something that they should do actually is maybe teach nurses how to use EMR, like even before they leave nursing school,
Oh,
because
for
like some of the big ones like Epic,
sure.
Meditech, like these are huge things, right? That
Mhm.
typically hospitals have been training nurses on, but wouldn't it be great if nurses came out of nursing school with at least a basic understanding of EMR and maybe even doing some practice patient charting or something like that? I think that would be really cool.
Yeah. There's actually a nurse at my work who has well, she's retired just recently, but she actually created a EMR for nursing schools for them
Oh,
to
wow.
practice, and, there may be others out there too. I just know about hers from interpersonal networking, right? But, you're right, that's so important, and I do feel like that was helpful because when I was in nursing school, I was working as an aide in the hospital, so I was using it to chart, I's and O's and temperatures and blood pressures and basic stuff but turning and bath and all that, and so you get that interaction and that comfortability with the flow sheets and how to keep a record of things and demystifying one more part of the process so that when I came out of nursing school, that wasn't like a foreign language, right?
Yeah. Yeah, I think there's probably so many types of remote nursing you could learn about, but at a basic level, I think knowing how to do a video conference or maybe even doing some case studies if there's someone on a call, like maybe even doing a telehealth call, how would you kind of work through that with a patient? So, yeah, I think and I do think it's really important actually to know how to write a good resume and interview because I
Mhm.
wasn't taught any of this. I actually I was using the same resume I had from high school. I was just updating it for years and years,
Mhm.
just kind of adding to it. And I know there are nurses out there that still do that. So if you are listening and you haven't updated your resume really in 10 years and you just keep adding things to it, might be time for just a refresh. And I'm not saying you have to hire someone, but I'm saying just understand in today's market, what does a resume look like that will get you calls back, and just understanding things like applicant tracking systems and what that is when you apply for a job.
Okay, what is an applicant tracking system? Because I haven't applied for a new job in a while.
Okay, so this is a form of AI that has existed way before ChatGPT. So when you apply to any job, if you are applying through a website, then you're going through something called an applicant tracking system. And it is really just a fancy word for computer screening software. So unless you're physically printing out a hard copy resume and handing it to someone, or you're emailing your resume directly to someone, you are going through an applicant tracking system. And this is really just designed to save time for the people that look at the resumes once they get them. So they might be hiring managers, they might be actual unit managers, and based on what you put in the resume and or cover letter, it kind of screens it and compares it to the job posting. And it assigns you a rank on how closely you match the job posting. So whether you end up at the top, the middle, or the bottom of the list depends on the applicant tracking system and how you kind of scored within that system. So hopefully that makes sense, but that is what applicant tracking system is. So things that can throw it off are if you have really fancy formatting. So if it's too heavily formatted, like I know a lot of people go on Etsy and they buy a resume template, which looks beautiful, but there's so much heavy formatting that it kind of interferes with how the program reads your resume. And
Oh, no.
typically it reads it all the way from left to right. So if you have those fancy templates where there's a column on the left side or a column on the right side, or you've got like images, it kind of scrambles how the program works, and it just mixes up all the information. So it's best to kind of keep to a simple layout that reads all the way across left to right, and doesn't have any images or logos or things like that.
So it's not good to have your headshot in the resume?
No, no. You should not have a headshot because in a lot of cases that can disqualify you from being considered, because that's bias, right? So if you put a headshot there, then
Mm.
people know your gender, they could guess your age, they could guess your ethnicity. So we actually don't want headshots. Headshots are just for LinkedIn, not for your resume.
Well, that's probably true. Could you imagine if somebody's, like, looking at my resume without a picture of me? They're like, "Well, she's probably either African American or Hispanic for sure," and I might get accidental affirmative action.
Yeah, 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 yeah.
So, oh, well, I guess that could go either way, but the formatting thing was really interesting. I didn't think about that. Now, mostly when I share like a CV or something, it's with if I'm going to speak at a conference or whatever, and it's like listed my publications at the end of it. So it's more to give to people who've already decided to work with me, because I haven't
Yeah.
applying for a bunch of jobs. But that's really helpful to know.
But I think you're giving them more of a one pager, right? Like this would be you're already working with the organization, so it would help for them to know what you look like, and you're not going through an applicant tracking system. You're sending it
Right.
directly to someone.
Correct, where they're gonna open the PDF and actually look at it and yeah,
Yeah, yeah.
exactly. So, your big picture perspective is as you've been in this coaching space long enough, about a decade now, right? You've probably seen some different waves of change in these remote opportunities. Is there a trend that you're seeing right now that you don't think is getting enough attention in our profession?
Well, I actually didn't start out with remote nursing. I just started out wanting to help nurses. And even before that, I was writing resumes for people in all different industries. And then eventually I decided I wanted to help nurses. But it wasn't even until the pandemic, I would say halfway through,
Okay.
that there was interest in remote nursing, because it wasn't even really a thing before the pandemic. So there's this huge interest in remote nursing, I would say, like from 2020 onwards. But then there was this kind of shift back, so a lot of jobs were calling nurses back. So jobs that were remote that could bring people back, they were bringing them back into the office. So I've seen that happening recently. And then I saw this trend of where the pay for remote nurses is really going down and down and down. And I think it's because some people are just so desperate for a remote job that they'll take it regardless of what the pay is. So I have seen
Mhm.
that happening recently, where it's going down to like, I mean, we're talking like $20, $25 an hour. So way less than you'd make
Whoa.
at the bedside. Yeah. And I think it's because we're not pushing back again, because there are nurses that are so desperate for remote work that they'll take it regardless of what the pay is.
Mm.
So I've been seeing a little bit of that recently, but I think this is where you just have to decide what your priorities are. And this is what I talk about with nurses all the time. It's like, are you looking for work life balance? Are you looking for opportunity for learning growth? Or are you looking for pay? And it's fine if you want all three, but maybe if you prioritize the top two or even the top priority, that will help you figure out
Mhm.
whether or not this is the right opportunity for you. Certainly, I've done all three, right? Like I've had a remote job, I've had a job where I learned a lot. I've had a job where I made over six figures, but I was really unhappy in some of them and it was a really toxic work environment. And I had to decide, is this still something I want to do or do I want to see what else is out there?
Yeah, really weigh the pros and cons of it.
And it's a scary thing to do because I call it the golden handcuffs. If you've got a job you've been at for a long time and you've got health benefits and you've got pension and people that rely on you, it can be really scary to leave. So you just have to, there's no right or wrong answer, but you have to decide at the end of the day, what do you want your future to look like?
How fun are these golden cuffs, right?
Yeah, yeah.
So this brings me to the $1 billion question that I ask every guest on the Nurse Rosa's Insights podcast. So, Sarah, if you were given a grant for $1 billion to meet a need you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
I would actually like to focus on patient ratios and not even just patient ratios, but like I know that there are some ratios where they mandated at one nurse to four patients. I would even propose to lower it less than that. So having one nurse to two or three patients and actually make it sustainable and have it that people can staff up, like overstaff every shift rather than have it short. I think that would be something I would want to do because I've never heard of a nursing overage. I don't know if anybody has.
Nope.
I've
Nope.
never heard of, "Oh, there's too many nurses, like, what are we gonna do?" I've never heard that conversation, even back when I started nursing, and I know nurses that have been doing this for 50 years, it's still the same conversation. So if
Yeah.
I could change things, it would be to give nurses less patients, like, less than what is maximally allowed, and actually let nurses be able to provide more care and go above and beyond what they're currently able to do even when there is adequate staffing. That was my first proposal. Can I just go into like part 2 because I thought of this
Yes.
today. Okay. So wouldn't it be really great if you could work less than 40 hours a week to be considered full time?
Well, like 30, less than 36 hours, because then 3 12s is
Yeah,
36.
like what if you could just work 2 12s and that would be considered full time as a
For
nurse and
insurance purposes, is that what you mean?
insurance pay everything. You'd get everything the same, but you'd work less hours and you'd be considered full time. Because I know there are professions out there like flight attendants that work less than the 40 hours and they're considered full time. And that's what I would propose if I was in charge of things and I had all this money to spend. Is just let nurses work less because I posted once on LinkedIn and I got a lot of pushback on this where I said our bodies are not designed to work 12 hours. And a lot of people pushed back because they said to me, "Well, Sarah, I like my days off. I want my days off." And I get that. So I wasn't saying that you should not have your days off. What I was saying that is that I don't think we're meant to work 12 hours. But I understand why people like it, right? They like to stack their hours so that they can have the stretch of the days off. So, is it that they like all the hours that they're working, or is it that they like the stretch of days off more? And I'm assuming it's they like the stretch of days off more.
And that it was assuming that you could not have both. But you're saying,
Right.
like, why not have an 8 or 10-hour shift instead of a 12-hour shift just to not wear your body down?
Yeah.
Yeah.
Yeah. That's
Yeah.
all I was saying. So that would be my second part if it was me in charge of things.
And, I would layer on top of that, same for doctors. Let's make their lives easier too and lessen
Yeah.
their hours and let them sleep more.
Yeah.
So, I mean, we're human people, especially with all the advances we're hearing might be possible with technology. Like, I really would love to see that be utilized to relieve the physical burden on doctors, nurses, and all the other healthcare clinical providers so that and not just say, "Oh, we're gonna add twice as many patients on because you should be
Mhm.
twice as productive because of these tools," which is what I'm afraid is gonna happen in a lot of cases.
Yeah, that is the fear. I think nurses, I mean, like, do you follow Rebecca Love on LinkedIn?
Oh,
Because
girl, you have not been looking at our LinkedIn enough. Yes, we've been in some pictures together.
oh,
She was
okay.
on this podcast a few weeks ago.
Oh, that's awesome. Well, she talks about how nursing was always rolled into like the hospital
Mhm.
expense, right? So we were never seen as income generating. We were seen as an expense. And I think that's the problem, right? We have to change how people view nurses. And that the fact is, you wouldn't be able to function without nurses. So stop thinking of it as an expense and think of it as a value add and income generating.
Yeah, exactly. And, maybe billing for it would provide the more visibility to that value. But then there are even other people who are talking about building systems of preventative care that are led and run by nurses
Hmm.
who may or may not bill for their services. Maybe it'll be private pay, right? Kind of like concierge medicine, but like concierge nursing.
Yeah, that'd be nice.
Yeah. And just prove the concept.
I would love to see that.
Yeah. Well, I think there's some pilot programs going on out there. So if you're listening and you're one of them and you want to talk to me about it, come on, let's do it. I think, we gotta prove some of these ideas are possible. And we can't necessarily wait for adoption from some big fancy institution. Sometimes you gotta prove it on a smaller scale. And maybe what would work is a lot of smaller scale operations that preserve the humanity of the relationship between the caregivers and the patients.
Yeah, definitely. Yeah, I think that we need more funding towards nurses and remove all the barriers to getting that funding. I think that's a big issue too, is that as someone who wants to start an initiative, you have to go through all these hoops to apply for funding and write essays and this and that. And it's like not everybody can do that, but I'm sure there are a lot of people out there passionate about the work and they need to be able to trial it and see how that goes.
Exactly. And I think there are some that have proven, that they're effective at keeping people out of the hospital and preventing chronic diseases from worsening and maybe even getting better. So that's, I think that's definitely worth doing. But I love the ratio priority as well. As an ICU nurse, you better not ever give me more than two patients for sure.
Well, as a former NICU nurse, I loved having 1 or 2, but it was like when I had 3, even though they were not as acute, they'd be like, "Oh, don't worry, they're not intubated." I said, "Yeah, but that's a lot of things to keep track of." And
Like, do you want to have triplets by yourself? No.
exactly, it's like you're running back and forth, and there's all these
Yeah.
meds and all these schedules to keep track of, and the parents and the doctors. It's a lot, right? I think at
Mhm.
the end of the day, it's better if we can focus our energy a little bit more and not be so scattered. And that's where I feel like mistakes happen is when there's too much going
Mhm.
on. Not to say
Exactly.
that nurses can't do it, but we shouldn't have to do that all the time.
Yeah. Yeah.
Mhm.
Well, I feel like this has been an absolutely incredible conversation that I am so excited to have because I've been reading your words for years now.
Oh.
So to get to have this exchange is just great. Do you have any upcoming events or speaking opportunities that people can find you at, or is LinkedIn the best place to find you?
I'm keeping it pretty quiet this summer because my kids are in sports and we're going on vacation, and I'm also camp nursing. So,
Oh,
yeah, yeah, I'm gonna be a camp nurse. I do that every summer. You can find me on LinkedIn. So Sarah with no H, Fung, Fung, or you can go to my website, sarafung.com. Or if you're ever interested in some career help or you need some guidance, you can go to my website. It's thernresume.com. And, I'm really happy that we got to have this conversation today and hopefully this leads to more in the future.
yes, this was so lovely. So, for our listeners, please let us know in the comments if you learned anything or if you have any additional questions. And if you know of any other thought leaders who have a $1 billion idea that would transform healthcare and make a healthier future, please point them my way. I would love to talk to them and amplify good ideas because that's what we need. So feel free to follow me on social media at Nurse Rosa Speaks on all the different platforms, or find me on LinkedIn. I will have Sarah's links in the show notes below. So please like and subscribe wherever you're listening or if you're watching on YouTube, and I'll see you in the next episode.